to change out my patient's ostomy bag. The first thing I'm going to do is compare the physician's orders, and just make sure that I do have an order for everything, and I do. And then I'm going to identify my patient, gather my supplies. So I'd ask my patient their name and date of birth and compare it to the armband, and everything matches. And then I would perform some hand hygiene and put on some clean gloves. Okay. So first thing I'm going to do is I'm going to empty out the bag. So I'd have like a little urinal thing. Just kind of open it up and empty all the contents out. And then after that, I'd kind of roll it up like this and unhook the bag from the stoma site and throw it away in my lovely biohazard bag. And then I would take the securement device and unhook it very nice and gently and throw it away in the biohazard bag. And then I would kind of look at the site. I'm going to take some warm water and kind of rinse it off nice and gently and throw that away. And then the site looks pink, there's no drainage or anything, so it looks how it's supposed to. You want to make sure it doesn't look purple or dusky or have like purulent drainage, because that's a sign of decreased circulation and infection, and that's really bad. So I will pat it dry. Okay, throw that away. Then I'm going to take my new little securement device. I'm just going to eyeball it. And I want to make sure that I trace around, and I want it to be about 1/8 of an inch larger than the stoma. If it's too small, it'll cut off circulation. And then if it's too large, then you can impair skin integrity, because all the contents will aggravate the skin. So I've done that. Here's my little new securement device. I didn't really get any contents on my hands because it was not dirty, but I will go ahead and change my gloves just to be safe. But first I'm going to perform some hygiene, so wash my hands. Put on these new gloves. Okay. So I do have the eyeball. It is 1/8 of an inch. So I'm going to take the new one and peel off the adhesive and place it in. Kind of hold it down. Make sure it's nice and sticks on there nice and good. Then I'm going to take the new ostomy bag and I'm going to clip it in place. Okay, and I'm going to make sure the bag is closed, because we don't want these contents to get on the floor, because that would just be bad. And then afterwards, I'm going to take off my gloves, throw them away, perform some more hand hygiene, and document the patient's response. The patient handled it very well. This wasn't their first go around, so they knew what to expect. The stoma was pink, no drainage, so no signs of infection or decreased circulation. And yeah, I'll just document that the procedure was done.